Good morning, Dr. Shaffi.
Good morning. What brings you in today?
I've been having trouble remembering things lately. I'll walk into a room and forget what I needed. I've also been feeling weak and discomfort in my arms and my legs, and every once in a while they'll wreath, and I can't stop it or anything.
Are you having any trouble with your vision?
Well, sometimes I see colors, and they're kind of blurry and washed out.
What about headaches or hearing loss?
Yeah, I've been getting migraines almost every day, which lead me to get dizzy and feeling fatigue a lot. My hearing has been normal though, and I haven't had trouble with it. Something strange I've noticed and forgot to tell you are these red rash-like things on my wrists and my knees.
Are there any other symptoms I should be aware of?
I sometimes have chest pain and a shortness of breath.
Okay, well, I'm gonna check out a few things here. Can you please stand on one foot for me?
Yeah, sure.
Do you smoke tobacco or drink alcohol?
No,
Do you exercise regularly?
not regularly, just when I have time.
Okay, well, I think you may have APS. It's also called sticky blood syndrome. Have you heard of this illness before or know anything about it?
No, would you please tell me more?
Well, it stands for anti-phospholipid syndrome. So basically, APS is an autoimmune disorder where your immune system, which usually defends your body from bad bacteria and viruses, accidentally attacks the tissues and cells, which therefore damages them and the body's functions. APS is characterized by the formation of abnormal blood clots. This is also called thrombosis. This can block blood vessels. Thromboses can develop in any of the blood vessels, but is frequently occurring in the lower limbs. If there's blood clotting in blood vessels in the brain, then blood flow is impaired and can lead to stroke. This condition is associated with the presence of three abnormal immune proteins or antibodies in the blood. These are lupus anticoagulant, anticardiolipin, and anti-B2 glycoprotein 1. Antibodies normally bind to specific foreign particles and germs, marking them for destruction, but the antibodies in antiphospholipid syndrome attack normal human proteins. When these antibodies bind to proteins, the proteins change their shape and bind to other molecules and receptors on the surface of cells. Binding to cells, particularly immune cells, turns on or activates the blood clotting pathway and other immune responses. The production of lupus anticoagulant, anticardiolipin, and anti-B2 glycoprotein 1 may coincide with exposure to foreign invaders, such as viruses and bacteria, that are similar to normal human proteins. Exposure to these foreign invaders may cause the body to produce antibodies to fight the infection, but because the invaders are so similar to the body's own proteins, the antibodies also attack the human proteins. This diagram can explain to you how the immune system normally works. Antibody will bind to the antigen and activate B lymphocytes. The antigens get ready for phagocytosis or consummation and act as opsonins. Then, the opsonin antigens will clump together and activate the antibody. Mast cell deterioration causes the antigens to deteriorate, and complements will finally come in and enhance the antibody's abilities for future invaders. Antibodies help defend the body against pathogens and infection. In APS, the antibodies mistakenly attack phospholipids, a type of fat. When the antibodies attack phospholipids, cells are damaged, causing blood clots to form in the arteries and veins. Even though blood clotting is a normal bodily process that helps seal small cuts and prevent you from losing too much blood, in APS, too much blood clotting can block blood flow and damage organs. Endothelial cells, monocytes, and platelets express proteins that lead to thrombosis. Thrombosis can therefore cause strokes and other deadly effects. Symptoms of APS include chronic and repeated headaches, dizziness, dementia and poor memory, development of chorea, transverse myelitis, which is the inflammation of the spinal cord, weakness and numbness of the limbs, and deficits in sensation and motor skills. It can also cause optic neuropathy, which is the loss of vision with colors appearing suddenly washed out, hearing loss, net-like rashes over your wrists and knees, speech changes, nausea, pain, and swelling of the limbs, chest pain, and shortness of breath, balance difficulties, blotchy skin, and fatigue. People with APS are more likely to develop blood clots, which can lead to high blood pressure, deep vein thrombosis, or DVT, which is a blood clot that forms in a vein deep in the body, stroke, heart attacks, and pulmonary embolism, which is the blockage in one of the blood vessels of your lungs. Some of these symptoms occur from APS inhibiting protein C and S in the coagulation cascade, which leads to a decrease in antithrombin 3 and fibrinolysis. This diagram explains the pathophysiology of APS. Endothelial cells increase TF adhesion molecules and pro-inflammatory cytokines. Placental tissue decreases trophoblastic cell growth and IL-3. It also increases apoptosis or cell death.
Do you know if I have blood clotting or where my blood is clotting?
By the sounds of your symptoms, it seems that the blood clots are occurring in the inner linings of the veins of your limbs and have started to form in those of your brain as well. Blood clots in your brain are very serious and you are at risk for stroke.
What caused this clotting to occur?
There are a variety of dysfunctions that may have caused your blood to clot excessively. Natural procoagulants increase blood clotting by activating prothrombin to thrombin. If you have an increased level of these, then that would be why your clotting is greater. The opposite of this would be natural anticoagulants. These revert thrombin back to its inactive state of prothrombin, so clotting continues to occur. There's also a bodily process called fibrinolysis. This is what prevents blood clots from growing too much. You may have abnormal fibrinolysis. Multiple genetic and environmental factors likely play a part in determining the risk of developing APS.
Is there a cure?
There is no cure, but there are treatments to reduce the symptoms and prevent complications. To get rid of the clots, your blood will need to be thinned to reduce the clotting with blood thinners, either as a pill or injection under the skin or into a vein. Blood thinners may keep existing blood clots from getting larger. Warfarin and heparin are two blood thinners used to treat APS. Warfarin is in pill form and heparin is given as an injection. Aspirin can also thin blood and prevent blood clots. These blood thinners don't prevent APS, they just reduce the risk of further blood clotting. Treatment with these medicines are long-term.
Thank you, doctor. What are the side effects of these blood thinners?
The most common side effect is bleeding. This happens if the medicine thins your blood too much, which can be life-threatening. Sometimes the bleeding is internal. In order to prevent the blood being thinned too much, you will need regular blood tests to check how well your blood is clotting. Also, these tests show whether you're taking the right amount of medicine. Now, before I prescribe you with any blood thinners, I will need you to take a blood test to confirm the diagnosis of APS. The blood test will check your blood for any of the 3 APS antibodies: anticardiolipin, beta-2 glycoprotein 1, and lupus anticoagulant. All I will do is take a small blood sample that is drawn from a vein in your arm using a needle. The procedure is quick and easy, but it may cause some short-term discomfort and a slight bruise. You will need a second blood test to confirm positive results. This is because a single positive test can result from a short-term infection. The second blood test is often done 12 weeks or more after the first test. While we get in the process to take these blood tests, for right now, I recommend that you exercise regularly and eat a healthy diet to prevent high blood pressure and diabetes, which are both diseases that increase the risk of stroke. If diagnosis comes out to be positive for both blood tests, then I will prescribe one of the blood thinners to you, and you'll need to complete regular blood counts, which is a type of blood test to count the number of platelets in your blood.
Is this a rare disorder?
It's not very rare, but it's not common either. It is estimated that 20% of individuals younger than age 50 who have a stroke have antiphospholipid syndrome. 10 to 15% of people with systemic lupus erythematosus have APS. Similarly, 10 to 15% of women with recurrent miscarriages likely have this condition as well. Approximately 70% of individuals diagnosed with APS are female.
Thank you.
Do you have any questions?
I don't have any more questions, so I'll get back to you next week with those blood test results.
Okay, sounds great. Thank you for coming in.